Remote check has really helped change how we are able to serve our pediatric patients. We know one of the most impactful factors for children using their implants is how many hours a day they use it and how quickly they get to full-time use of their device. And in the past, we were able to see an average over a month or many months of how much they use their processor. And we might say, your use is really low and we need to do better. Whereas now we can look at daily data logging with remote check and really hone in on what times of the week they're doing really well and what times of the week that use is lower, and help the families drill down and target some strategies to improve those specific times and days.
How we perform remote care with paediatric patients is really involving either the family or the parental guardian, letting both the paediatric patient know what's going on, but also keeping the family or the parental guardian involved, and making sure everyone understands what the remote care is all about, what the intention is, and making sure, that they're on board with the idea that we can keep looking after the child even without them being in the clinic.
We're really noticing that the benefit for our paediatric population, which for us is more of the adolescents with remote care, is that they are a lot more open with what they tell you rather than face-to-face in front of mum or dad. So they will message you back and forth often, or they'll put a lot more detail in their questionnaire and remote check than they give you face-to-face. The other feedback we've had from our recipients in that age group is they don't have to have time off school. So particularly for the later years of school, they're not missing out on those crucial classes. It's not cutting into their study time a lot less by being able to have appointments remotely, or because they are really focusing on their studies, whether it's like end of school or for university, that they can have more checks more regularly without having to come to the appointment. So they feel like they've got that support as they're going through those educational changes and demands as well. So that's where remote care is really helping us for that pediatric adolescent space.
For us, we definitely use the remote care tool in pediatrics when there's a problem. So let's say a mom tells me that her kiddo was riding his bike in the street, fell off his bike, hit his head. Oh, I'm so worried. I know you've told me this internal implant is so delicate and so important. What do we do? That's a really great opportunity as a triage tool to check impedances with the device. The family's at their home, we can send a remote check to the caregiver's phone, they'll complete it, and it's a way for us to check in without them having to come to the clinic.
Seeing children through remote care has its own unique challenges. So much of what we do relies on responses from the child that are subtle and take really an experienced eye watching the entire child and not just the overt feedback that they're giving. So we're still working through how to overcome some of those challenges. But I also think that those children tend to be one of the largest populations that have a lot of device issues. They're wearing their device and they're hard on it. So being able to connect with a parent just to troubleshoot a device versus having them to come all the way into clinic is really valuable.
I would recommend using remote care for pediatric population, particularly for the adolescents and teenagers. I think it's a really good way of getting them to take ownership for their hearing health care and for them feeling like they're connected and that they can share with you where maybe they don't feel comfortable to speak up face-to-face in the clinic.
I would recommend talking with your team about how you can implement remote care for children. When I first started thinking about remote care for kids, I thought of it more as an all or nothing, as a replacement for programming or not using it at all. And after using it a bit, I see the nuance of using it when we're doing some more surface level troubleshooting or really trying to drill into a specific issue, as opposed to a replacement for the actual in-person programming process at this point.
Yes, I would recommend remote care for paediatric patients. It's another tool for us in our audiologist toolbox to make sure that we're looking after our paediatric patients to the best of our ability. Adds a layer of assurance for parents and the audiologist as well, to make sure that the device is on the air and working as well as possible. As we all know, kids' lives are pretty busy and their processes can get up to all sorts of mischief. So if anything does happen, we can be there to support them.